Today we're going to talk about why doctors are quitting medicine. By the year 2036, it is projected that we will have a physician shortage of between 13,500 and 86,000 physicians. Now 2036 is only 12 years away. What are we going to do? Why are doctors quitting medicine? Hi, I'm Dr. Sandy Coleman, and I'm a physician who quit medicine. Less than a year ago, I pivoted to a non-clinical career. I pivoted from being a bedside physician after being a hospitalist for almost 13 years, and I now work in a non-clinical position. Welcome to my channel. I'm going to get more into my reasons why, but for now, just know that doctors are quitting medicine. This episode is going to dive into why this is happening and what you can do if you're a doctor who's considering a career pivot. Those of us in healthcare know that there's a growing problem with burnout, not just in doctors, but in all healthcare workers. The system and healthcare itself has changed so much. I graduated from medical school in 2007. There have been so many changes. There are increasing pressures, increasing workload, more difficulty in receiving compensation, and this is turning physicians off. The AMA reports that in 2021, approximately 63% of all doctors reported having some symptoms of physician burnout. Factors that contribute to physician burnout, we all know. They include long working hours, increased friction between the physician and the healthcare system, dealing with difficult situations in people's lives. Sometimes it just wears on you. I know society sometimes thinks that physicians are these cold robots who don't care, but if you've ever had a good doctor, you know that they do care. And believe it or not, your doctor might just be thinking about you when they go to bed at night. And this can chip away at your morale and your ability to perform your job and participate in your profession. Physicians are human just like anyone else. They wake up every morning, they go to bed every night, just like you do. And over time, the pressures of the profession can just wear on a doctor. What are the factors that doctors are facing that leads to physician burnout and possibly quitting medicine and making a career pivot? Many of us know that that includes increased administrative pressures, dealing with the electronic healthcare record, EHR, a shift from focusing on quality to focusing on productivity. All of this together can lead to serious mental health issues, stress, a feeling of just wanting to give up, decreased satisfaction with your job and with your everyday patient interactions. And in the middle lies the patient who's suffering the most, the family whose heart is breaking for their loved one who's suffering maybe a major illness, and maybe your family who's watching you drag yourself out of bed and drag yourself to work, to a job that may not be so fulfilling anymore. There are many reasons that I feel contribute to the fact that so many physicians are leaving the profession or pivoting away from full-time clinical practice. These factors include lack of fulfillment in their job due to the fact that they feel that they cannot treat their patients with the freedom that they would like to have because of the constraints of time, administrative demands, and parameters set by insurance companies. As you know, most of us went into medicine hoping to improve our world, hoping to improve our society, hoping to make a difference in the lives of our patients, as well as in our own lives. For some of us, becoming doctors was a huge deal. Maybe you were the first doctor in your family. Perhaps you were going to be the person in your family who would be able to earn more, be compensated better, and change the trajectory of your family. When it gets to the point when you start feeling like a donut maker or just a cog in the wheel. Now don't get me wrong, not every physician who pivots from full-time clinical medicine is burnt out, but many are, and there's no shame in that. We're only human. Those white coats are not capes, and we're not superheroes. Many physicians are pivoting from full-time clinical practice because they want a work-life balance. Many of our patients may not know that most physicians actually do not leave work at work. Many doctors are taking work home, maybe finishing notes on their home computer with their babies in their laps. They're missing out on what makes life valuable. Also, remember that physicians are typically fairly intelligent and they may have interests beyond the bedside. There's a lot of physicians who are getting involved in various side gigs, real estate, consulting, so many other opportunities, and they might find themselves wanting the freedom to explore these other possibilities. Another reason why you may find physicians pivoting from clinical practice. They're finding it more difficult to continue to support their family. They're having to work more for either the same amount or in some cases even less money. Now, most of us do not go into the profession for the money, but we do have bills to pay and we have lifestyles to support and our own personal goals and dreams. Many specialties and fields in medicine are compensated on the lower end, and they may find it more difficult to increase the amount of money that they make in order to provide a better life for their families. Making more means working more, and they just can't squeeze any more hours out of the day. In this channel, we are going to focus on physician career pivot. As I said, I myself have recently pivoted from a wonderful career at bedside to a career in the pharmaceutical industry. I am doing clinical research and I'm really loving it. I feel like I'm still able to help patients and help society because regardless of how one feels about the pharma industry, unfortunately there will always be sickness and disease, and we're going to need treatments. Let's explore the common fears that physicians face when they're exploring a career pivot. 1, identity. Remember, most doctors chose this profession at a very young age. I myself decided to be a doctor at the age of 3. I wanted to be like my pediatrician. Even if you didn't decide to be a doctor when you were a toddler, most likely it happened early in life and you embarked on a long and rewarding journey toward a medical career. Your family and friends were happy for you and so proud of you. So the idea of pivoting from bedside medicine to a non-clinical career can really threaten your sense of identity. Financial concerns. Regardless of what your salary is in medicine, whether you're a pediatrician or a plastic surgeon or, regardless of what end of the spectrum you're on as far as your earnings, you're going to be concerned most likely about maintaining whatever lifestyle you have come to enjoy. Whether your lifestyle includes family vacations, sending your child to a better school that you have to pay for out of pocket, supporting elderly parents and helping to make their lives better. When it comes time for a career pivot, that is going to be a number one concern. Can you maintain your lifestyle? Are you going to now have to work 2 to 3 jobs in order to pay your bills and continue to fulfill your obligations to your family? Many physicians are burdened at some point in their career by student loans. Maybe you're worried about being able to fulfill those obligations or losing out on the opportunity to have loan forgiveness. Another obstacle that physicians face when they're considering a career pivot is fear of judgment. You're afraid of being judged either by your peers, your colleagues, other people that you work with, other people who may look up to you or who you may serve as a mentor for. Also the judgment of your family and friends. For me, this wasn't really a fear at all because by the time I decided to make the pivot, I had been considering it for several years. And I knew that many physicians around me probably wanted to do the same thing. So I really didn't feel like I was going to face judgment. One of the major obstacles that physicians face would be just lack of knowledge at their non-clinical options. Of course, you're not well versed because more than likely you've been entrenched in the practice of medicine, which is appropriate when you practice medicine. But when that time comes for a career pivot, sometimes you can find yourself at a loss when you're trying to gather information on what you can do and most importantly, what you want to do. If you're a physician considering a career pivot, not to fear. First of all, for most of you, it's not an emergency. Unless you're finding yourself facing job loss or loss of credentials or serious mental health issues, chances are you do have time to craft a plan, an exit strategy. So be encouraged. There's a lot of information out there and there are a lot of thought leaders in this space. If you're looking for more discussion on the state of healthcare as well as non-clinical options and the necessary mindset and information that you're going to need to make this transition, stay tuned to my channel, subscribe, and look for more episodes. This is Dr. Sandy C. Please join me in this journey as we explore our options beyond the doctor's lounge. I'll see you next time. Thank you.